everyone, welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Among post-transcatheter aortic valve implantation patients with infective endocarditis, cardiac surgery no better than antibiotics alone. Infective endocarditis is a common life-threatening disease with high in-hospital mortality of nearly 20%. It needs timely radical surgical treatment that involves the removal of the infected valve followed by the valve prosthesis implantation. However, a recent study suggests that cardiac surgery failed to improve the clinical outcomes when compared with antibiotic treatment alone among specifically the high-risk patients who developed infective endocarditis after transcatheter aortic valve implantation. The study findings were published in the Journal of American College of Cardiology, in which the authors concluded that the majority of the patients with transcatheter aortic valve implantation infective endocarditis were treated with antibiotics alone. Eating vegetables does not protect against cardiovascular disease. Researchers have observed that the consumption of vegetables might lower the risk of cardiovascular disease that might at first seem possible, as their ingredients such as carotenoids and alpha-tocopherols have properties that could protect against cardiovascular diseases. But so far, the evidence from previous studies for an overall effect of vegetable consumption on cardiovascular disease per se has been very inconsistent. A study in the Frontiers in Nutrition journal shows that a higher consumption of cooked or uncooked vegetables is unlikely to affect the risk of cardiovascular diseases. Drinking wine with food lowers the risk of type 2 diabetes. According to a new study, drinking wine with food was associated with lower risk of developing type 2 diabetes. The lower the type 2 diabetes risk occurred only when people drank alcohol with meals and not when alcohol was consumed alone. Further, it was shown that only moderate amounts of alcohol had a positive impact on the development of type 2 diabetes. Up to 1 glass of wine daily was recommended for women and up to 2 glasses daily for men. The authors then concluded that drinking moderate amounts of wine with meals may prevent the occurrence of type 2 diabetes with no other health condition that may be negatively affected by moderate alcohol consumption, and this all has to be done in consultation with the doctor. COVID-19 infection with survival after in-hospital cardiac arrest among adults. A recent study in the JAMA Network Open followed the reporting of observational studies in epidemiology reporting guideline. In this cohort study, approximately 1 in 4 patients with in-hospital cardiac arrest identified in the American Heart Association had a suspected or even a confirmed COVID-19 infection diagnosis. This observation underscores the sizable effect of the pandemic on in-hospital resuscitation, and the study showed a negative association of COVID-19 with survival, which was consistent across the various subgroups, including patients who received timely treatment with defibrillation and epinephrine. Physical activity trajectories with major cardiovascular diseases in elderly people. According to a study in the Heart BMJ journal, it reports that physical activity was associated with lower rates of incidence of cardiovascular diseases. A significant risk reduction was present among men and was stronger earlier in the late life, that is approximately 70 to 75 years. In conclusion, increasingly active trajectories of physical activity were associated with lower rates of cardiovascular diseases and even overall mortality. Promoting at least 20 minutes per day of physical activity early in late life seems to provide the greatest cardiovascular benefits. So exercise is the mantra. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.